Okay, welcome back guys to another episode of Between Two Derms podcast and the YouTube channel. And today we're going to be talking about the improvements in telehealth, especially over the pandemic, and how that impacted the care of individuals seeking dermatology care. And I do have a guest today. This is Dr. Emilie Bourgeault, and she is a dermatologist in Canada. And we're actually recording this in Toronto. So I came to Canada to record with Emilie, Dr. Bourgeault. So I actually came to Canada to interview Dr. Bourgeault and to work and partner with the DermaGo team. We first met at a conference in Paris, actually.
Yep.
And I was sitting next to Dr. Bourgeault and she was answering consultations on her phone. And I was like super curious about what she was using, and then found out that she actually developed this technology. So given the fact that I was so impressed with the platform, I wanted to ask Dr. Bourgeault to kind of explain the story and development of the DermaGo platform, where that came from, and kind of get us started with how DermaGo got started and to where it's at today.
Yeah, so I'm a Canadian dermatologist, like Dr. Portela said, and in 2018 we decided to launch the first virtual dermatology clinic called DermaGo.ca to really give access to patients so that they can directly consult dermatologists without having to go by, to see a family physician before to get a consultation. So we launched, and our goal was to really bring dermatology care directly to patients by using technology. And since then, we've done about 35, maybe now 40,000 cases in derm, and we have a team of dermatologists working with us in Canada in each provinces.
So 35 to 40,000 consultations, that's massively impressive. And I know that most of my viewers are going to be in the United States, and the health system is obviously a little different in Canada. And so in Canada, you have to have a referral from your primary doctor in order to see a dermatologist if you're using the government health system?
Yeah, exactly.
Okay. But DermaGo is not participating in that system, so anybody can just book directly.
Exactly, because what's happening in Canada is that, like in many countries, there's a lack of access to care and a lack of, a lot of wait lists for dermatology. So patients are waiting 6 to 12 to 18 months to see dermatologists. And as we see, the increase in skin cancers, minor conditions like acne, rosacea, atopic derm, like light atopic derm, a bit of psoriasis, androgenetic alopecia, these patients are waiting many years to see a dermatologist, and sometimes they don't even get access to care. And since Canada is also a country that's geographically, huge,
yeah.
With not that much population, some patients just don't have access to derm care because dermatologists are located more in, in urban centers.
Yeah.
So our goal was to really bring access to care for everyone, and we want it to be quick, we want it to be concise, we want it to be expert based, and we want patients to have access to the treatment plan immediately. So with DermaGo, they don't have access via the RAMQ or the public health system, depending on the province, but most insurance providers do reimburse, and the consultation is done within 24 hours up to 7 days, so depending on what the patient needs, and we do send the treatment plan and prescription directly to their pharmacy.
Okay, so there's a couple things that I want to ask follow-up questions on. The first is what kind of conditions you're treating on here, because one of the frustrations that I had when we started implementing telehealth in my clinic is that patients would sometimes be on their phone, and I like to say they're on their iPhone 4 in the Walmart parking lot, and lighting was horrible. They may be cutting in and out because we were doing what's called synchronous or real-time video telemedicine consultations. And if we were trying to diagnose a mole or a spot, we would often have to tell the patient, you can't come in, or you have to just come into the office. We can't do this over telehealth. And it was a waste of their time and a waste of our time. And so my experience led me to believe that there's only certain conditions that are really, really good to treat on telemedicine, and in fact, maybe better for everybody involved to treat by telemedicine, because we don't need to do a full body skin exam to diagnose acne or rosacea. We can often see a picture of the face and ask a few questions and really drill down the treatment plan as well as we could in person.
Yeah.
So how did you guys approach what conditions you're going to treat?
Exactly. So I think there's 2 points that we need to talk about is the concept of asynchronous versus synchronous care. So if we look at the literature in dermatology, asynchronous or store and forward care or store and forward consultations is definitely better than synchronous care. So that means that you're looking at the pictures, you're looking at the chart, and we're trained, we're dermatologists, we're trained to diagnose based on pictures. So a picture is worth, many hours. Yeah, exactly. So we don't want to do video. So that's the basics of DermaGo is to do asynchronous care, which means that the patient can fill out their chart in the morning before they go to work. They submit their pictures and they get their response at night when they come back from work. They can go directly to their pharmacy as they come home. So that's really important. The other thing is that yes, there are certain conditions that we need to focus on. So DermaGo wants to focus on benign conditions that have a big impact on patients. So, the psychological impact associated with untreated acne is still huge. So we want to target those conditions that can be well diagnosed on pictures, that, we're not going to miss a cancer, that we can treat online, and that has high patient satisfaction because the treatment plans can be really well established with this asynchronous consultation. So acne, rosacea, androgenetic alopecia, we can, help patients with periorificial dermatitis that not everyone knows about, but that is hard to treat sometimes. These 40,000 cases are mostly these minor conditions. And I'm also, it's very interesting to note that we do have a lot of Accutane patients on DermaGo. So in Canada, it's a bit different than in US for regulations, but we would I would say we have about 20% of our patients that have gone through Accutane on our site.
20% of 30 to 40,000 patients?
Yes.
Okay.
Yes.
That's crazy.
Yes, and we have excellent results. The patients are happy, and we don't have complications at all with all these patients. So this is a great something to think about for how we're going to address acne care.
That merits a follow-up question, because in the United States, anybody that's taken Accutane knows that you have to come into the dermatologist's office every single month. Many offices are still doing blood work every single month, and you can't have refills. You have to be seen in person. Anybody who is of childbearing potential has to have a pregnancy test done every month. And we have this whole system called iPledge that regulates this. And in the United States, if you misstep, like the doctor or even your medical assistant, if something goes wrong in that process, iPledge can remove your ability to prescribe Accutane. They can be very punitive. And then over the last year, they had an upgrade of the computer system, and the whole thing crashed. And there was about 2 weeks, maybe longer, where we could not even prescribe Accutane because the system was down. The pharmacist could get our prescriptions, but nobody could access iPledge in order to validate that it was done properly. And patients fell off treatment, some were lost to follow-up. It was a big problem. And so when US dermatologists and patients hear that you're prescribing Accutane by telemedicine and that you're not having the complications that iPledge is supposed to prohibit, that is something that I think needs to be published.
I agree.
But you're not seeing problems like frequent pregnancies, depression, all these things that people worry about. You're doing it safely, and you can prescribe refills in Canada.
Yes, definitely. So it's a bit more lenient, I would say, with regard. We don't have this iPledge system. I mean, we're physicians and we understand the implications of prescribing Accutane. We also understand that there's side effects associated with methotrexate, and there's no iPledge system for methotrexate. So I think we need to get to like, I was looking at the JAD, and there's some published literature that talks about the U.S. dermatologists prescribing less Accutane and maybe more Doxy and more topicals because of this hurdle to prescribe the Accutane. So do we really want to push systemic antibiotics and risk the resistance long term? Like, there's other side effects to other medications. So I think it's important to be able to prescribe the most appropriate treatment. With Accutane, definitely we don't want pregnancies, we know that. But the patients are aware of that, and there's other situations in life that, other medications that they may take that they also don't want pregnancy. So I think if you make it clear with your patient, you have a good plan, it's not necessary to have this paternalistic view of medicine and impose certain constraints. When I started off, I was a bit more, worried about this pregnancy risk, and yes, definitely in some patient populations it can be more worrisome. But one trick is, to do over-the-counter birth control tests with the pharmacist. The onus is on the patient. They know the implications. Do they actually have to get blood work every month? We know that for liver function and triglycerides, it's not necessary. The AED has published guidelines regarding blood work. So we don't, we need to evolve in the way that we're treating patients and that we're engaging them in their health treatment plans. I think that our database needs to be published definitely so that we can show the world that we can trust patients and we can help them. If you look at the US, there's 40 to 50 million patients that have acne. They need to have access to treatment.
That's a huge thing, and when I first learned that about DermaGo and dermatology in Canada, that blew me away, and I really want that to come to the United States because it would serve patients well. It would reduce cost, it would reduce burden on the healthcare system. Patients that need access to a dermatologist because they need them all checked out, they're not going to be competing with somebody who's coming in every single month for Accutane. And as you mentioned, we do prescribe many medications, even in dermatology, that carry a huge risk of causing birth defects, like methotrexate, even spironolactone, which is used frequently, can cause birth defects.
Finasteride,
minoxidil, all of these things which we're not doing monthly pregnancy tests for. So ultimately we have to have a trusting relationship with the patient, and the patient can lie. Unfortunately, they may tell us that they're taking their birth control and they're not. And so ultimately, this is something that we deal with other medications. And my understanding is, and you may be more aware of this, is that the iPledge system has not significantly reduced the rate of pregnancy before it was implemented versus after. It just really increased the administrative burden on the system.
And so I think that it's important for the people that make these rules and regs that they can have information so that they can reevaluate these systems. And in order to be able to do that, it's important for us to publish our data so that there's more and more information and they can balance the positives and the negatives of these publications. But I think we're going into the right direction of increasing access to care, trusting our patients, having therapeutic goals together as with the patient, with the physician, and we need to give access to patients with minor skin condition. I mean, they're going to see estheticians, they're going to see pharmacists, they're going to see skin gurus, they're going to see a bunch of other people because we can't give them access, and I think that's really important. As dermatologists, we are specialized medicine experts, but we also have a responsibility to offer first-line dermatology care because we're the best people to do that. So with DermaGo, that's really what we want to do.
Yeah, nobody else can do it better than dermatologists when it comes to the skin. And it's unappreciated, I think, in some circles. And patients may also just be self-treating online, listening to who knows who, some crazy person on TikTok. So. But that's important. Now, we all saw the value in telehealth as the pandemic really shifted the way that we deliver care. For a solid 12 to 18 months, it really was different. But you kind of got started with DermaGo before the pandemic. How was that received among your colleagues and among your professional organizations?
So the way the idea came around is that I was still doing my boards, so I was studying that year, and my colleague, my partner, Dr. kept texting me and saying, hey, listen, we need to do something. We're always on our phones and there's nothing that exists so that patients can consult. So the idea came from him, and then we worked on it to get the legalities all okay, and we developed the tech, and then we launched in 2018, so pre-pandemic. So this need to have a digital transformation was already there in our minds before the pandemic, and patients love it. So I think what's really important is also that it needs to be easy to use. It needs to be for certain conditions, and it needs to be technology that we can not replace traditional model of care into a virtual setting. So we're not booking 15 minutes appointments virtually and not seeing and not really understanding. The patient doesn't have access to Wi-Fi. It's breaking in and out like you're mentioning. But asynchronous, you don't need as much bandwidth. And patients, you can see these patients during your clinic days when there's no shows, when you have a little break that you want to do a few cases. So it's to really increase efficiency, for it to be easy to use, and that's really our goal in DermaGo, is to give quick and easy and expert advice for skin disease.
Yeah, that's so important, and I think that it will really improve the delivery of care of dermatology for those people that are seeking the telehealth and then those that are still seeking care in the office. It really kind of stratifies the risk based on what you're doing. So right now you're just in Canada,
Yep.
and in Canada you're licensed through the whole country.
Yeah.
So in the United States it's a little different, and we started to look into this because I was so impressed with the tech, I want to bring it to the United States. But I have to be licensed in every single state that I want to deliver care.
So in Canada,
it's a little different.
There's certain provinces, I guess, that you need to have a license in.
Yeah.
So we do have a team of dermatologists across the country that are available for DermaGo. But yeah, so those are the logistics that we need to deal with in the States also.
Yeah. And it's something that I would like to see different states get more up to date with their telehealth regulations, because in my home state of Idaho, the concept of store and forward or asynchronous telehealth, that can happen, but it can't happen on the initial consultation. So in order to be compliant with state regulations, a patient has to be seen either through telephone, like synchronous, or video synchronous visits to get started, which kind of defeats the purpose of a really efficient, asynchronous system.
Which doesn't really make any sense. So you receive a chart and then you're going to call them on the phone, and that counts as a video or a telemedicine consultation. But if you look at the chart, you see the pictures, you can make the diagnosis, that doesn't count. So obviously regulations need to change or need to evolve, I would say.
They need to be updated for sure. So DermaGo right now, you're seeing you've seen 30 to 40,000 patients on the platform.
Yeah.
Where does DermaGo go from here?
Yeah, so I think DermaGo, we think it's an excellent solution for patients and for physicians. We're very strong in our home province of Quebec, and we have a presence everywhere in Canada. But the easy time zone, the area to go to is definitely the States. And I think that our programs also in residency and the way that we practice is very similar in Canada and the U.S. And then there's a whole world of opportunities, right? There's people that don't have access to dermatologists everywhere around the world, and we need to be able to give them, quick, not too expensive dermatology care and access. So I think, yes, we want to, focus on the U.S. and we want to partner with you so that we can go state by state and offer this to your population, your big population in the U.S. But we're looking at the future and going elsewhere as well.
So what is your value proposition to a patient who may be hesitant to seek care online? Maybe they've had a bad experience, inaccurate diagnoses, also a system that doesn't take their insurance. When there are other, telehealth systems that may take insurance. So why does DermaGo hold the value for them to spend money out of their pocket and to maybe give online care a try again? Yeah.
So I think, DermaGo, we're physicians, we're dermatologists. So if you go on DermaGo, you have access to the dermatologist. You're not seeing an NP, you're not seeing, another specialty that is doing a bit of telemedicine, and you're not in a system that prescribes its own products. So, we are physicians and we're prescribing the most up-to-date guideline-based products solutions or what is it? Medications.
Medications.
And you can use the pharmacy that you want. So we don't have, we're altruistic in that nature. We're not keeping you in the loop that you need to keep having your packages sent in every month. So we're real physicians, real dermatologists that do the same as we would do inpatient or in-person care, but we're choosing conditions that we believe that are equivalent online, and then you get to do the consultation from the comfort of your own home. You don't have to take a day off work to go see your physician. You don't have to wait 2 hours in their waiting room. You don't have to pay for parking. You don't have to take your kid out of school. And within 24 hours that night, you get your prescription. So I think that's the value proposition, is that we're real physicians, real dermatologists. You're going to have great care. It's going to be efficient, and we're focusing on the diseases that we can diagnose very well online. So that's, I think that's our value proposition.
Yeah, that's a thing that I think a lot of patients get frustrated with, is that so many of these online solutions for acne or other things, they make you buy their product, they put you on a subscription, and it may be like a really low percentage, and then every month you have to get a new one, and it goes up and up and up and up, and then it takes 6 months before you even start to see the improvement, and it's clear that their revenue stream is from the medication. and then that's frustrating because you're really tied into one system. Whereas with DermaGo, you can get a prescription that is the exact same you'd be prescribed in person.
Exactly.
You pick it up at your local pharmacy. If you don't have a local pharmacy, it can be shipped to you, but it's not some proprietary formula.
No, exactly. And you know, we can recommend over-the-counter products that can complement your treatment. So for example, if you're taking, you know, a topical retinoid for your acne, well, yes, you know, a cream based with ceramides and hydrating cream is important to integrate into your system or into your plan. So definitely we can, you know, do the paramedical aspect of it too, but our focus is really to give patients the best treatment for them.
And I know in Canada, sometimes the patients still get samples of over-the-counter creams and cleansers, just like they would in the office. And that's through a partnership with La Roche-Posay.
Yeah, exactly, with L'Oréal, so that we can offer different samples so that the patients can really test what they like the most, so that they can complement their treatment.
Yeah. So again, just another way that it's as much as being in person as it can be in a more efficient system, but the time saver is huge.
Yes, definitely, and it's like being in person, but you don't need to be in person for these conditions. And you know, I do have in-person clinics, and every time I see a patient that has acne or that has rosacea that comes to see me in person, I think to myself, you don't need to be here. You know, if you just knew that you know, being treated online, it takes you 2 minutes. You're drinking your coffee in the morning and filling out your chart. You wouldn't have to take the half day off to come see me. So we can, you know, we're really looking at diagnosing the conditions that can be done online, and the literature does support, you know, the correlation, like the diagnoses are equivalent with asynchronous care as in-person care, and that's what we're focusing on.
What happens when a patient does a consultation on DermaGo and they upload their photos and it's a condition that maybe they think they have acne or they think they have perioral dermatitis, but they actually have a different condition and it's not appropriate to be treated online? What happens in that scenario? In
that scenario, we're going to tell them that this is not a condition that can be treated online and warrants an in-person evaluation. So we're trying to have a system of, you know, referral between physicians. It's not always easy, but we do give our recommendations. At the beginning of DermaGo, we used to take, you know, every case. So we've had dermatomyositis patients, we've had some melanoma patients, and so we've, you know, arranged to our colleagues in hospitals to see these patients. But you know, the goal is to give them an idea of what they have and to sort of guide them into what they can, you know, how they can access care. But that's why we want to focus on really the conditions that can be treated online. Yeah, absolutely. So if a patient is not a candidate for online treatment, do they get a refund on their deposit and everything? Yes. Yeah, that's good. Okay. Definitely. So really a good system. Yes. Okay. Well, I'm excited to see where DermaGo goes from here, you know, both in Canada and in the United States. Right now, a lot of your clients are French speaking, so if you are bilingual, if you're French speaking, that's great. Yes. But we're going to be getting into Western Canada more and then down into the United States, facilitating treatment, hopefully, eventually in all 50 states. So where can people go to learn if DermaGo is available in their area? So you can go on DermaGo.ca and you will, you know, you'll have your landing page based on your province. So you know, you'll see if it's available to you. So in Canada, it's available in every province except Saskatchewan right now. And in the States, we're coming soon. So if you go on DermaGo.ca or dermago.us for the States, we're going to give you some updates, and you can, until it's launched fully, you can see our blog and our articles and a bit of information. So, and I'm pretty sure that Dustin has very common posts or daily posts. So when we decide to do, or when we're ready to do the official launch, he can let you know. Yeah, we'll be providing updates there as well. And then for those that, you know, just from a transparency standpoint, DermaGo is somebody that I'm partnering with. And so to declare the conflict of interest, as we like to do in medicine. But I've looked at a lot of telehealth platforms, and just watching how efficient it is, I was seriously impressed with it to provide high quality care with standardized photo methods that give accurate diagnoses, and then not locking a patient into a subscription where if you don't need follow-up, you don't have to follow up. You get a treatment, you get better, you're done. You don't have to keep spending money, because we're cognizant of the price of healthcare. It's burdensome. It's not easy. High deductible plans, you know, all the ancillary expenses that go along with it, with driving and parking and everything. So And you know, you keep saying what's the added benefit. So let's say it costs you $180 to consult. You get your consultation with a dermatology. You get your prescription sent to your pharmacist. You didn't park. You didn't have to buy lunch. You didn't have to take a half day off work, and you didn't have to, you know, buy all these other products, you know, for 6 months before you came to see the dermatologist because you weren't sure how to treat your skin.
Right.
So you know, I think you're going to be kiff in your money spent.
Yeah. So if you're interested in learning more about DermaGo, whether in Canada or the US, we're going to include those links in the video description and in the podcast show notes. So that's dermago.us, dermago.ca, and then we'll also have links to Dr. Bourgeault's social profiles and Dr. Dore. So you can follow them as well, especially if you're French speaking.
Yeah.
I don't speak French. If you want to learn dermatology stuff in French, they're the ones to go to as well. So thank you very much for taking a little bit of time coming on the podcast, on the YouTube channel, and I'm excited to see where DermaGo goes from here.
Excellent. Thanks.
All right, thank you.
Bye.